Stay here. Go ahead.
This is the surgery center where Dr. Elizabeth Potter operates on breast cancer patients. She's actually in surgery right now. She made a video in January talking about an incident she had with a health insurance company while she was operating on a patient.
It's 2025 and insurance just keeps getting worse. Never had this happen before.
In her video, which she posted to Instagram and TikTok, Dr. Potter described being in surgery when she got a message that a health insurance representative was trying to reach her about a patient who it turned out was already on the operating table.
So I scrubbed out of my case and I called United Healthcare. And I was like, do you understand that she's asleep right now? And she has breast cancer? It's out of control. Insurance is out of control.
Her video has now been viewed over 13 million times across platforms and inspired other doctors to weigh in.
This is exactly what is wrong with insurance companies dictating the kind of care that patients should have.
They put in place systems that require physicians to jump through insane hoops to get obviously appropriate care for a patient.
I didn't think that it would resonate so deeply, but once I saw the comments coming in, it just uncovered something that was already there.
Days after her post, United Healthcare demanded she remove the video from her social media channels, accusing her of making false claims.
What I said in that video was true.
What happened that day?
I got a message that United Healthcare had called the operating room and wanted to speak with me. And immediately my mind went to, oh wow, are they going to deny something for this patient? I looked over at my partner, another microsurgeon who's there, and I said, I think if I take this call, I might make a difference for this patient.
They say United Healthcare did not ask or expect you to scrub out and call right away. Why call them back right away?
No one made me. That was my choice. I thought they might deny her. Could they stick her with a giant bill that could be financially devastating? And I have seen that. The environment that I'm practicing medicine in is when an insurance company says jump, I say how high. And that just doesn't feel good for patients.
United Healthcare declined our request for an interview, but in a statement, a spokesperson told CNN in part it had approved the patient's surgery and overnight stay days earlier, but its medical director reached out to the hospital for clarification after the hospital submitted a separate stay request United calls erroneous, and that the director had asked to speak to the nurse caring for the patient. United Healthcare emphasizes he did not ask to be transferred to the operating room department, did not ask to speak with the physician while she was in surgery, and never asked the doctor to leave surgery. United also added, most importantly, the patient received all necessary care, was not responsible for the erroneous bill, and the surgery and overnight observation stay are covered by the member's plan with minimal cost to the patient. Dr. Potter's video came weeks after United Healthcare CEO Brian Thompson was shot and killed. In a letter to her, the company accused her of creating a potential life and safety threat for its employees, noting some commenters on her video were invoking and seemingly praising Thompson's accused killer, Luigi Mangione.
I would never condone violence. I'm a doctor. I take care of people. But if we're going to talk about it, then what I would say is it is not my fault that United Healthcare had the reputation that it had that led people to react that way. I did not promote those comments, but Americans are speaking out.
Is this unique to United?
And this is not unique to United. There are two competing interests. Doctors wanting to take care of patients and companies and industries prioritizing financial profit. That is at the heart of insurance and healthcare.
For Potter, who specializes in breast reconstruction for women with breast cancer.
Thank you so much.
Insurance is an inescapable part of her conversations with patients.
Dr. Potter, how are you? Alrighty. You guys.
This looks really, really good. And we already have a little air in there.
Yeah.
You're going to look gorgeous.
I have been far more terrified of insurance, like by a power of 100 than the cancer. So the cancer itself feels to me kind of manageable.
We go through and get approval. Is this going to be an outpatient home the same day? Are they going to stay overnight? What kind of anesthesia do we want? What materials do we need in the operating room? And insurance gets to weigh in on all of it.
How much of your job is this?
A lot. I've heard before, like insurance shouldn't practice medicine, but they are. They're in the room, and the balance has shifted so far towards cost controlling and efficiency that it feels less like I'm able to practice the best medicine for my patients.
While her video about United got the most attention, Potter's frustration is with the insurance industry more broadly and shared by colleagues like fellow breast cancer surgeon Dr. Julie Sprunt.
We have a young patient who's in her early 30s. She was so upset that her insurance wouldn't cover the wigs that she wanted to wear while she was getting chemotherapy. And I thought of how hard she has worked as a nanny to pay into insurance, it starts to feel like the humanity that is so necessary in healthcare isn't there anymore.
I didn't go to medical school to learn how to decipher insurance plans. I went to medical school to learn how to take care of human beings. And I would assume that insurance would help facilitate that and not create obstacles. I think there's a good place for insurance, but we've got to have a reckoning. Maybe something really good could happen. We'll see.